Hello friends, as you all might be aware, bariatric surgery is a surgery done for the treatment of obesity. But interestingly, bariatric surgery is also a treatment for the treatment of diabetes, for control or even cure of diabetes. Surprised? Okay. Let me go through the history of how bariatric surgery evolved and how this diabetic surgery evolved. It was in the year 1954 when this great guy called A.J. Kremen published the first article claiming that by bypassing certain portions of the intestine that we can treat obesity based on his research on the small intestine. From there on, bariatric surgery evolved into different leagues, new procedures came in, and then the year 1960s and the 70s and the 80s, there was a huge surge of bariatric surgical numbers in the Europe and North America. But please note, these were primarily done only for the treatment of obesity. In the early 90s, this great guy called Professor Walter Porys tried to retrospectively study how his patients who had a bariatric surgery were doing. To his surprise, he noted that a significant percentage of patients, I mean more than 90% of his patients, who also had diabetes. Please note that these were patients who were operated for obesity who also had diabetes. More than 90% of them, the diabetes disappeared. The diabetes was not there. It was like, oh my God, what is happening? Initially, he was not sure why this diabetes improved. He initially thought probably the weight loss that the bariatric surgery gave to them was probably improving his diabetes also. But that was not true, because usually weight loss takes a slow curve and the improvement of diabetes took a very quick curve. So if weight loss was the reason for diabetes improvement, both should go parallel to each other, which was not happening. So that is when he worked with his endocrine colleagues to try to understand what was the reason behind this. And they understood that there was something wrong in the intestines that they were bypassing unintentionally. Because bariatric surgery, certain portions of the intestines are usually bypassed. That's how it's done. Then later they came to understand that these intestines they were bypassing had some problem in hormonal production called incretin therapy, incretin effect, which they were bypassing without the knowledge. So that's how they understood that bypassing the intestines can actually treat diabetes. From there on, even the diabetologists started to understand that the problem in diabetes is primarily in the intestines and not just insulin production and insulin action. Today, most of the drugs that is being given for diabetes are drugs that treat or control the intestinal hormones, which are controlled in bariatric surgery. So this concept was removed out of bariatric to try to treat patients who are not so obese or non-morbidly obese but having uncontrolled diabetes. That is, they might be taking insulin, multiple tablets, but still the sugar controls are like super high. These kinds of patients. Patients who are taking insulin shots every day and like, oh my God, it's so paining, these kinds of patients. And patients who have developed secondary complications of diabetes like nephropathy hitting the kidneys, retinopathy causing problems to the eyes, or neuropathy causing nerve problems. So these kinds of patients, even if they are non-morbidly obese, these kinds of bypass surgeries, of course there are many different types of surgeries which needs to be tailored to the right patient. These kinds of bypass procedures can be used for the treatment of diabetes because we are modulating the intestines and hence modulating the intestinal hormones which is causing these high sugars, hence by bringing them to normoglycemia. Even the American Diabetology Association, the premier body for diabetes, brings out guidelines every year, have endorsed metabolic surgery as a treatment of uncontrolled diabetes. And we now have published data claiming long-term remission of diabetes. In colloquial terms, if I need to put it, cure of diabetes is now scientific, It is possible by modulating the intestines, but then it is not like every diabetic patient would be operated or needs to be operated. The right patients need to be chosen, the right evaluation needs to be done, and the right surgery needs to be done. And this is called diabetic surgery, or in medical terms, metabolic surgery.